pain, also called otalgia medically, can wake you up from your sleep and can disturb your night. So I am Dr. Sanjeev Gupta talking on this. I am practicing ENT surgeon at Apollo Hospitals, Bhubaneswar. Most commonly in children, ear pain will wake the child up and the child will start crying. It will be impossible to quieten the child with your soft words, and therefore you need some home remedy to make the child, put the child back to sleep. The most commonly used medicine in India is paracetamol, and you can give child a spoon of paracetamol so that he can go back to sleep, as the child pain will decrease. But however, you will have to go back to the ENT doctor next day morning and show the child to the doctor. Most common cause for infection in the child is because of cold and cough. Cold and cough will spread to the ear and it will cause infection inside the eardrum. As the infection is happening inside a closed cavity, it will cause pain in the ear, and it needs treatment with antibiotics. Self-administration of antibiotic is not recommended, as you may be giving a wrong antibiotic and giving wrong doses. Therefore, you should visit a ENT doctor and get treatment for the ear infection. After a course of antibiotic, the ear will recover completely and child will be normal. In adults also, you get ear infections. Also, you get insect in the ear sometimes. Also, you will get pain referred from the teeth, or if there is infection in the throat, or if there is a pain in the cervical spine. So there are multiple causes of ear pain in adults, and this needs to be evaluated by a doctor, ENT doctor, and should be treated according to the cause. Most common cause is actually infection in the ear, which again needs antibiotics. The rest of the causes are a little rare. However, when you get a pain in the night, you can always take a paracetamol or a ibuprofen tablet, which will reduce the pain, and you can sleep for the time being, so that you get back to the hospital or get back to the doctor on the next day. In adults, common cause for ear pain is infection in the ear. It can be acute, which is also called ASOM, or chronic, when the ear is getting infected repeatedly, or it is also called CSOM. For acute infection, treatment of choice is antibiotics. For chronic infection, treatment of choice is surgery. CSOM is a common cause of ear disease, and it can be treated with a simple surgery to take care of the ear infection. CSOM is of two types. One is when there is simple perforation of the eardrum and the infection is in the middle ear, and it gets treated with a simple surgery. In case the infection has spread to the bones or the mastoid part of the ear, then the surgery has to be extended to drill the mastoid bone, and it is called unsafe CSOM because the infection is in close proximity to the brain. Other common causes are impacted wax in the ear, when the ear has not been cleaned for a long time and the wax builds up and it causes pain in the external ear canal. It needs to be treated by removing the wax after putting a solvent in the ear. The solvent makes the ear wax soft, and the ear can be cleaned in the doctor's OPD clinic. Other causes are referred pain from the cervical spine, especially in elderly, when the cervical spine has spondylosis, and this causes a referred pain to the ear. This needs treatment is basically to take care of the primary cause, which is spondylosis. Other causes of ear pain is poor dental condition with caries teeth, which also causes pain, referred pain from the tooth to the ear. Treatment is again taking care of the tooth and needs to be treated by a dental doctor. And the other cause is when you get a sore throat or pharyngitis, which can be acute pharyngitis due to streptococcus infection, and this needs a treatment with antibiotics. So most of the causes can be treated mostly medically, and a few cases of ear pain needs to be treated surgically. Another rare cause is pain in the ear due to an insect which has been left behind, as the patient has forgotten about it, and the insect has died inside the external auditory canal or the outer part of the ear canal. After some time, the insect gets decomposed and there is infection in the external canal, which is also called otitis externa. And in rainy seasons, some people will get infection in the ear due to otomycosis or fungal infection. As the water has gone inside the ear and the fungus has grown in the ear and it has not been mopped by the patient, and the infection builds up inside the ear, which later on causes collection of fungus in the ear, and it also causes pain. Treatment of fungal infection or insect left inside the ear is very simple. Patient has to visit a ENT doctor and it will be removed under microscopic or endoscopic guidance, followed by instillation of antibiotic or antifungal drops. So basically, otalgia or ear disease can cause severe pain, severe discomfort, but the treatment is simple and one should take some home remedy or painkillers to take care of the pain, and also visit the doctor to take care of the condition. Thank you.